We have Snehdeep Bohra, who's the Director Corporate Ratings at Fitch, and we also have Ravi Dadhich, who's the CEO of Pharmaceuticals and Medical Devices Bureau of India, Jan Aushadhi, joining in. Thanks a lot, gentlemen, for joining in. Coming to you first, what has resulted in the strong growth in Janaushadhi sales, Mr. Dadhich?
So, wider reach of these stores in all the districts of the country means the presence of Janaushadhi stores is now in 750 districts of the country. And its regular availability of medicines along with the wider product basket, which is around, say, 1800 medicines and 285 surgical and other devices. And with presence of almost 9700 Janaushadhi Kendras, they all contribute towards a more acceptance of Janaushadhi in the country.
Okay, so Mr. Dadhich, if you're talking about increasing traction because of number of reasons that have come by, is this traction limited to tier 3, tier 4 cities, rural areas, or are you seeing increased traction even in tier 1, tier 2 cities?
So at present, the increases in the tier 1 and tier 2 cities because these Janaushadhi Kendras are more or less in urban areas or the district headquarters. But still, out of this 10,000 number, around 55% of these Janaushadhi Kendras are located in the block level or the tier 3 cities, as you can say. But the rural areas are yet to be covered, for which, since we are already almost approaching our targets of 10,000 Janaushadhi Kendras, recently, Honorable Prime Minister has given a new direction to the scheme by announcing that there will be 25,000 Janaushadhi Kendras in years to come. So we are working and making an action plan for the same.
Okay. All right. Mr. Ravi, I just wanted to understand, there is this perception of lower quality when it comes to generic drugs. Can you give us a sense in terms of how exactly you are bridging that perception, and is that actively changing on the ground?
Yeah, so the objective of this Janaushadhi Pariyojana was only to allay that fear and to do away with this notion that generic medicines are poor in quality. So, and obviously so also that people, when they buy medicines at a very discounted price or at a price which is say 50 to 90% less than the branded versions, they have a doubt. But to do away this fear, what we do is that we procure all the medicines through WHO GMP certified companies only. And even after placing the orders with these companies, when we procure these medicines, there is a centralized procurement in our 4 warehouses located in all parts of the country. After receiving these products, every batch is again tested, is sent for these products are anonymized and then sent to NABL accredited labs for retesting. Only after getting a report which is suitable or the standard quality of medicines, we supply these medicines to our distributors and Janaushadhi Kendras throughout the country. Not only this, we also keep on regularly checking the stock available with our warehouses as well as in the Janaushadhi Kendras, and also compare them by sending samples to these NABL labs. So that we get to know that the medicines are having the same kind of potency in terms of its assay or its dissolution or presence of permissible impurities, etc. So all these steps means 100% rechecking of the entire stock ensures that the quality is good.
Okay. Mr. Bohra of Fitch Ratings also joins in for this discussion. Mr. Bohra, wanted your thoughts. Do you think that there's already a significant dent which is taking place in the branded generic segment because of generic drugs picking up, may it be from the government, may it be from a trade generic segment of a pharmaceutical company?
Thanks, Ekta, for having me. So, yes, I think the growth in trade generics has been higher than the broader pharma market growth. But then I think as of now, we don't think that, this will have a very significant impact on the overall branded generic space. This is mainly because I think the widespread adoption is still some time away. And while the growth in Janaushadhi and other trade generics sales has been higher, I think the mainstream stakeholders, I think they still need to sort of be more comfortable around the quality aspect before this thing can gain further traction in the market. So I think we don't see a major impact in the next 2 to 3 years. But then, yeah, obviously, I mean, we'll have to see how quickly the whole trade generics space grows in future.
Right. Snehdeep, just as we were, as you were talking, that graphic which talks about the difference in the prices between Janaushadhi, the generics and the branded generics is extremely wide. Even as the quantum of shares don't move too much, do you think there is case for this price gap to narrow going forward?
I think price in Indian market is anyway sort of defined by the competitive forces, as there are a number of players selling the same drug. I suppose that any change in price would really depend upon that. But as of now, I think the way the whole marketing of drugs sort of works in India, I see there is no major threat to the prices as of now, unless there is a very significant shift towards trade generics in the years to come. I think that will really impact the prices and the drug companies' margins, in my view.
Okay. Mr. Dadhich, quickly, if you can tell us, where are you seeing more traction? Is it the chronic drugs or the acute drugs in the Jan Aushadhi basket?
Yeah, certainly the chronic segment is growing very fast. And as even these lifestyle diseases, which are very common and people need these medication on a regular basis, obviously there is a higher demand of these medicines pertaining to cardiovascular and diabetic segments. And we are focusing on that as soon as we get any medicine which is off patent or which are not covered in our product basket. We try to bring those medicines in our product basket and make it available for the customers. And as far as pricing was just being discussed, I'll just mention that the medicines under Janaushadhi are priced at a principle of 50 to 90% cheaper than the market branded medicines. And while procurement of these medicines is done by the government agency in a very transparent manner, there are very less number of levels where we have to spend money. So we save money on that, and that benefit is transferred to the customers directly.
Okay. Just quickly, Mr. Ravi, if you could leave us with the growth trajectory that we can expect for Jan Aushadhi. You've grown 50% plus in terms of revenue CAGR in the past 5 years. Is that going to continue?
Certainly, with more number of Janaushadhi Kendras and its acceptance and publicity, all these factors will contribute its growth on the same pattern in the coming few years.
Okay. All right, Mr. Ravi as well as Snehdeep, it's been a pleasure. Thank you very much for joining in, and more power to you all for actually, lowering prices when it comes to Indian drugs and making accessibility and availability even greater.